Second round of voluntary serology testing is underway in Rhode Island. The testing is looking for antibodies which are produced in response to the presence of a virus. Sign-ups are now live to try to schedule a test to determine if someone may have been exposed to a virus like COVID-19. Alexandra Leslie spoke to one of the doctors overseeing this effort for the Department of Health.
I spoke with Dr. Philip Chan, the consultant medical director for the Department of Health. Chan says the test will determine how widespread COVID-19 is in the state or certain communities by looking at Rhode Islanders in certain high-contact professions.
So this is a test where you can really use it to say, is it likely or not that I had COVID-19 in the past?
Dr. Philip Chan says the incentive to be tested for antibodies is so health leaders can figure out the prevalence of COVID-19 in Rhode Island. DOH staff members plus first responders, Rhode Island National Guard, correctional facility workers, and healthcare workers are invited to a second round of testing. You can't have had COVID-19 symptoms or a positive COVID-19 test within the last 2 weeks in order to be eligible. Chan says this is because antibodies take anywhere from 7 to 14 days to develop.
After 14 days, they're very sensitive about picking up past infection.
Rhode Island is one of 3 sites across the U.S. selected to participate in the study and is the only full state selected.
So when we talk about sort of wrapping our hands around the state, it's much easier here than elsewhere. I think that's one of the appeals and one of the reasons the CDC chose us is so that we could really do our statewide population.
Results will not tell you if you're currently positive or negative for COVID-19 or if you're immune to the virus.
But we actually expect to use this study and others to help monitor that, to see if people who have antibodies can actually get the virus again.
Tests will be processed by Quest Diagnostics with results in about 4 days. While there is a backlog of PCR-based diagnostic tests with Quest nationally, Chan tells me that there is less of a demand for serology tests, which are done on a different platform. I'm Alexandra Leslie, Eyewitness News.